This report is based on an investigation by Der Spiegel and ZDF. What they uncovered inside Kenya's booming kidney transplant industry is deeply disturbing, involving poor local donors, wealthy foreign recipients, and a network protected by silence. In Eldoret, Kenya, a police officer agrees to meet with reporters, only under secrecy. Hidden behind hedges at a restaurant, dressed in civilian clothes, he whispers that investigating organ trafficking has cost him peace and nearly his safety. He says he's found evidence, even victims and witnesses, pointing to illegal kidney transplants in local clinics, but was warned to back off. These people have friends in the system, he says. When asked if that includes the government, he nods. One name comes up, Dr. Svarup Mishra, a former MP and founder of Mediheal Group of Hospitals. According to the report, Mishra is described as extremely influential. One of the cases gathering dust in the police files is that of Amon Kapruto Mili, a 22-year-old who lives near one of Mediheal's facilities. Mili says he sold his kidney for €6,000 and was paid $2,000 less than promised. He had hoped to use the money to start a taxi business, but the car broke down, and so did his health. He now lives with constant pain and regrets the decision, calling it the biggest mistake of my life. Mili says the operation happened at Mediheal, and despite a doctor telling him he was too young to donate, the kidney was still removed. In the town of Oyugis, investigator Willis Okumu, working with a platform supported by Interpol, found over 100 people who had sold kidneys. He says many former donors now work as recruiters for Mediheal, receiving commissions. Okumu believes this system thrives due to powerful connections. It's not even being well hidden, he says. And yet it continues, as if those behind it were untouchable.
From our research, these young guys are saying that they were paid various amounts of money, whether it's the initial 700 when there was a little bit of people coming in, or the 300 or 350 that is being paid in the recent times. And they are pointing out that they were paid after undergoing tests and procedures in a specific place. So for us, as far as I understand it, this is actually happening based on negotiations with brokers and agents that are representative of this facility. Yeah.
Patients from countries like Israel, Germany, and Russia are flown into EKA Hotel Eldoret, a 4-star hotel where MedLead, an associated transplant agency, arranges their stay. Access to the transplant floor is restricted, and many recipients don't ask questions. One Israeli patient admits, "You're not supposed to pay, but you pay." He describes how recipients sign papers falsely claiming donors are relatives. A longtime clinic worker confirms this practice, saying donors declare they are donating for free, out of charity, a move that legally blurs the line between victim and accomplice. One Israeli woman, unnamed in the article, paid €200,000 for a kidney transplant at Mediheal, only to learn the donor was not a tissue match. A note from an Indian lab stated no match, and that the donor, from Kazakhstan, was unrelated. Yet documents listed him as a cousin. The kidney failed within 2 weeks. It had to be removed. She lost her house to fund the surgery and now relies on dialysis in budget housing. Sabine Fischer-Kugler, another patient, was more fortunate. Her transplant was successful, and she returned to Germany within 6 days. She barely saw her donor, a young man from Azerbaijan, roughly the same age as her son. MedLead had advised her not to interact with him. Fischer-Kugler declined to reveal how much she paid, but confirmed it was a 6-figure sum. When told that many Kenyan donors only receive about €2,000, she responded, "Absolutely not fair." Still, German clinics in Nuremberg and Erlangen refused to provide her follow-up care, citing ethical concerns. Only a long-time doctor from her earlier transplant agreed to help. According to Der Spiegel and ZDF's investigation, what's happening in Eldoret isn't just a black market trade, it's a system. One where desperation meets money and silence ensures continuity. This is not just a story about Kenya. It's about the global underbelly of healthcare, where inequality is a business and organs are currency. For more details on the full expose, check the pinned comment, We've linked the original investigation there.